National Infertility Awareness Week aims to destigmatize infertility, educate about its causes and treatments, and advocate for better access to fertility care.
Co-founder and lead fertility consultant at Lilly Concierge Consulting, Whitney Bischoff, joins us now to share important things you should know. Whitney, thank you for coming in. We were just telling you that both Amy and I have been through IVF, and that's how our children came, well, both of mine, one of yours, came about. And you yourself also had that journey.
Yes, absolutely.
Tell us a little bit about your...
You know, so it started in 2013 when I froze my eggs. I was a fertility nurse. I was hearing, about this technology, the science that was, new and upcoming, and I decided to make that step to freeze my eggs, not thinking that I would actually ever need them. It was more of sort of this insurance policy. But once I met my husband and we were trying for baby number 2, we were struggling with secondary infertility, which many people don't talk about.
That was me too.
Really?
Yep.
Okay, absolutely. So it's, we were trying to get pregnant, it wasn't working, miscarriages, ectopic. We did end up thawing the eggs and fertilizing them and, preparing for a transfer, which was not successful. And then we found out we were pregnant naturally.
Oh, wow.
But it is so nice to know that should we want to have another child, we do still have those embryos. And that was because I froze my eggs when I was young, when I was 27.
Oh, so they're young eggs too.
Yes.
Yeah, because many of us, I should say, you spend so much time in your life trying not to get pregnant.
Absolutely.
But when you can't and you're jumping into the world of IVF and infertility, there's so much thrown at you, you don't know enough.
Yes, absolutely. And I think that's why education is so important. And that's part of what Lilly does is really being proactive and taking an actionable approach, because it is a very scary process to navigate, and to have that support can mean a lot.
So where do the gaps... The one thing I felt was like, I'm a woman, but I know nothing about my reproductive system when going through this, because the doctor's talking, and I'm like, what? What are you talking about?
Yes.
So do you go through a lot of education?
Absolutely. I mean, there's so many gaps in our healthcare system. I mean, number one, we're hearing so much about people that are being affected by infertility, 1 in 6, and that number is continuing to go up. When we look at the global fertility market, we see that by 2027, it's going to surpass $45 billion. But unfortunately, in the U.S., when we look at the specialists, the reproductive endocrinologists, or the REIs, we're only seeing about 1,250 of them practicing, and only about 55 per year are coming into the field. So that's leaving about a gap of 8 million people that are needing care, but unfortunately, there's not a ton of specialists that are able to provide that care, which provides a big gap right there, because our healthcare system is feeling more increasingly mechanized, and people are not getting their questions answered because of the fast-paced environment that these providers are having to work in to see everybody.
Well, and I think this is interesting about where you guys come in, because you're not necessarily a replacement for someone's primary care. You're there for supplemental help. And it's before, during, and after.
Yes, absolutely, because that fills another gap, and that's the emotional well-being of these families as they're going through this and trying to navigate it, because it is a very emotional process. And so at Lilly, what we do is we're not taking over your physician's care, and that is so important. We're extending outside of the clinical setting. Really, when you're vulnerable and need it the most is outside of those clinical walls. And so what we do is we're there to help, provide the support, but also help you advocate for yourself, help you know what to ask at your next appointment. Maybe it's time to get a second opinion. So all of those different things that you may not be thinking about when you're there, because again, those appointments go by so fast, then that's when Lilly comes in and we help bridge those gaps for fertility, but into pregnancy and postpartum as well.
So someone at home listening might want to wonder, or might be wondering, what qualifications do you guys have in order to be able to give this advice?
Absolutely, and I think that's a great question to ask, and one that should be asked. So our co-founder and myself have over 40 years of clinical experience in reproductive endocrinology. I've been a nurse in the field for over 17 years. She's been a nurse practitioner in women's health and obstetrics and gynecology. So we have that clinical experience, and we know the science, but we also know the personal side as well, because both of us, as I mentioned, have gone through treatment ourselves.
That's so important too, because again, now, so far removed from it, I'm like, wow, was that mind-blowing? And as you mentioned, it goes so fast.
Yes.
You don't think about anything until it's all over.
Right, and I mean, I think people don't realize that they need that extra support until they're in the thick of it. Because clients, patients, they're overwhelmed, they're under-supported, and they need that help.
What would you say is the first step for someone who may be on this journey?
I think number one, it is doing your research for your, the facility that you're working with, not just the physician, but also the laboratory, and look into something like that support outside of the clinical setting, because we know, unfortunately, that the physicians are only able to do so much in that short amount of time, and we know that it is an emotional struggle that goes along with this journey, and you may need some extra support.
Yeah, because you want that baby, you don't want to say no, but you don't know what you're saying yes to a lot, and it's just a lot coming
and
at
then the
you.
frustration, and you don't know how to vent because nobody necessarily knows what you're going through.
They don't, and I think that that's so interesting, right? Because we know that 1 in 6 people are impacted by it.
Yes.
But when you talk to someone going through it, one of the first things that they say is, I feel so alone.
Yes, absolutely. Nobody understands me.
Right.
This is, Whitney, thank you so much.
Thank you guys
I
so much for
appreciate
having
you.
me.
For more information, you can visit lilyconcierge.com.